Welcome to SurgiPod, the podcast that delivers you all the latest trends and developments from the world of surgical practice administration. Each episode, you will hear from thought leaders in the sector sharing their valuable knowledge, insights, and predictions from a range of perspectives. And now for your host, Justin Rockman, Vice President of Surgimate, the leading surgical scheduling and coordination technology provider. Enjoy the podcast.
I'm joined today by Mark Filiault. Mark Filiault is the Chief Information Officer at Connecticut Orthopedic, one of the leading privately owned orthopedic practices in New England. And it's really great pleasure to have Mark joining us today on SurgiPod. So thank you, Mark, for joining.
Thank you very much for having me. I'm really excited. I don't get a chance to spend a lot of time on podcasts. But, Nobody really cares to hear what I have to say, but I'm happy to share whatever I have to share.
We're very, very interested in what you have to say. And so first, Mark, thank you again. It's also love to hear a little bit about your own personal journey in becoming the Chief Information Officer, the CIO at this leading practice. Tell me a little bit about how you got to where you are today.
Isn't it always a journey? People's careers take a lot of different pathways in different ways, but I guess my journey began in the late 80s when I had spent the first 12, 14 years of my career in the television business. And shortly after the Macintosh was introduced in 84, I got that urge to learn more and get more involved. And so we bought a bunch of computers at our TV station and began to use them. And then in 1988, I stepped off a cliff and I went into computer sales. And my first job was selling desktop publishing systems for Macintosh and graphic arts houses. And then that turned into video editing solutions. And then that kind of transposed into networking. And then the Mac versus Windows discussion, which is now Google versus iOS, was happening. And so we started getting involved with businesses. So I changed companies and helped them in building out strategic business networks. And it was a huge market. Y2K happened, if you remember Y2K.
Absolutely.
That was a windfall for all of us in IT services because everybody had to replace all their equipment. And so fast forward, it was around 2010, we did a relatively big uplift for virtual infrastructure for Connecticut Orthopedics, who was positioning themselves for some growth. And when the project was completed, the CEO kind of tapped me on the shoulder and said, you need to stay because this is a little bit too complex for all of us. And I was at that point where I needed something different. So I said, okay. Joined on, and at that point it was more of an operational capacity. So suddenly I had radiology techs working for me and medical assistants, and so went through all of that. And now that we've grown further, my sole responsibility is just technology. How can we use technology to stay out in front?
Excellent. So technology, data, that's really your bread and butter where you come from. Do you feel that is what also helps make Connecticut Orthopedic different? And what else makes Connecticut Orthopedic different with offering the services which you offer today?
Well, I think the commitment from the group since it's been 10 years. So in the last 10 years, the commitment has never waffle. It's been, we need to be cutting edge. We need to be pushing the envelope to how we can use, because we're competing in the marketplace. We're competing for customers. We're competing with and against the hospitals. And we have to drive value and creativity into our process. We don't have an unlimited checkbook like maybe some others. So competition breeds innovation. And so the group recognized early on that if we can be more efficient, we can be more innovative, it can help us in our growth strategy.
Absolutely.
So technology is very important around here.
Absolutely. So technology has really become, in your opinion, one of the linchpins to be able to be more successful as an organization?
We believe so. We don't think it was an accident that we were where we were at the time. The group came together about 8 years ago when our CEO had a vision with some of our other leading physicians here in ownership to create partnerships with the hospitals, but there's also we're competition at the same time. So strength in numbers. So 5 orthopedic groups came together and formed a kind of a super group. And so we're 58 physicians and growing. And with strength in numbers come responsibilities to serve a big group. We have a lot of employees, physicians, et cetera. So the group is a little different because we're a little bit bigger here, at least in Connecticut. We're very regionalized. And so there's a lot of responsibility to make sure that our technology is out front, to stay in front. And there's also a sense of individuality that we wanted to make sure that each doctor is running its own enterprise within the organization as a whole, but yet all, sharing and communicating with each other. While we're competing, we're almost competing with each other, but we're also helping to foster one brand and one institution.
And it is really different options that practices have gone down over the last few years, either being purchased by hospitals or private equity. You've chosen to stay independent, largely independent, not go down those other paths. What do you feel are the sort of the advantages and disadvantages of going in that direction? How does you think it's helped your organization and your practice thrive?
So we didn't have much of a choice. We chose the path of independence versus the path of being swallowed up. So our independence has led us to be forced to have that individuality. Independence comes with responsibilities. Partnership is critical. So the big hospital systems are all being standardized by kind of this big epic thing. And we've chose to stay outside of that. For how long, we don't know. But the reality is we have to interact with the hospitals and other providers. In fact, the government's mandating that we interact with each other and exchange critical information, patient outcomes. And the only way to do that is to have systems that can talk to each other. So that's part of what
interoperability. It's one of the major banes of everybody's existence. How have you handled that interoperability with the different systems, both internally and also outside with the external systems?
Well, painstakingly in some ways. The technology is probably not as much of the prohibitor as just the process and the culture, quite honestly. We're specialists, right? So we get referrals from doctors or patients find us on their own. But I am still amazed at the fact that we process in excess of 50,000 faxes a month in this place.
Wow.
So while we talk about interoperability, we talk about the ability to communicate, there's still a lot of old school thinking that goes into how we do what we do. So interoperability is a work in progress. And we're still working at it. We're participating, we're driving it, but if the primary care still wants to fax us a referral, I can't do anything about that.
I remember going to the HIMSS show over a decade ago, and I did this like tour between the different sort of providers. Start off with a primary care physician, then went to an OB/GYN, then to a specialist. Now magically all the data would somewhat come together, and still I go into practices today and I see fax machines and paper and every sort of archaic system in the world.
They hand you a clipboard and say, fill out this form.
Don't show that PHI there. So there you've got some, got all these back-ended systems. It sort of looks like a series of madmen from the 1960s of how everything is running. Healthcare, like how come healthcare hasn't caught up? Look at other industries, travel, financial services. Healthcare still hasn't caught up. What's your feeling? You're a data guy. You're an informations guy in the trenches there. How can that change?
I think it is. It's just taking a little while to get there. The private sector is trying to solve it on their own. And I think as more and more entities, let's think back to what happened. By 2008, the critical financial meltdown led to a small $1 billion bailout. By today's standards, that's nothing. Right? Yeah, we threw $1 billion at the problem, and part of it is they put a small piece in there for something called meaningful use. And that was CMS's first step to say, okay, we're going to request that everybody get on electronic medical records because the paper is the problem. And so it's 10 years, it's been 10 years since that's happened. And we're still not quite there yet. It's still a work in progress. But 10 years ago, shortly thereafter, there became like 37 EMR companies. And there's not 37 anymore. So that number is consolidating down. So we will get there through more consolidation and more mandated innovation that with interoperability happen.
Yeah. So as CIO, like data is so critical to everything which you do. What are the key data points that you look for in your decisions, and how much does data actually influence the decision-making process at the practice, both from a managerial point of view, but also from the doctors? Like when the doctors sit and discuss, how much are they thinking about data in the decision-making process for the growth of the organization, especially as you get larger and larger?
I think that they don't think about it as much as I'd like them to think about it, quite honestly, and nor should they need to be. They're focused on what their responsibilities are. My focus is changing in the last, really just seemingly last couple of years, where it's all about security these days. Whereas, we always worried about desktop antivirus and whatever, but to have the concept that our data is being held ransom by some entity like totally changed the game of where our focus needs to be. But to your first question is like, how do you make questions about data? Inherently would always start with the economics part of it, where there has to be a total cost of ownership in the formula. So when you evaluate option A versus B, there's the cost up front versus the cost ongoing, operating versus capital, et cetera. There has to be some kind of return on investment, if you will, to use a business term. And so it's always been part of our driving responsibility to make the economics work and then provide as much value as we can into whatever solution we invest in. Because let's face it, if we make a platform decision, it's got to have a 5 to 7 year lifespan at a minimum. So we better make the right choice when we do things.
Right. Now, you've seen every evolution of the technologies in the last few decades, from mainframes to client server. You talk about security and privacy, and a lot of that's, I assume, to do with the fact that so much data is today held on the cloud, and that's the way in which things will move forward. You're not holding servers, I assume, as they have a few, but you're not holding what you had 5 years ago at least. How else has that sort of changed the way in which things work within the practice in terms of efficiency, productivity, having most of your core business applications being held on the cloud today?
I wish that was true.
Okay.
I wish that was true. We are well on our way. The ship has left the harbor, but in reality, our numbers just don't match up to that statement. We still have a large responsibility for infrastructure that is key to us here. I do believe, and my strategy is in fact to leverage what the cloud has to offer, but these modern applications have to be correct. They have to be right for us. It has to go back to the earlier principles that I said. There has to be the return on investment has to make sense, and the total cost of ownership has to work. But we are well on our way. But there's still a lot of infrastructure that inherently has to run within our environment.
Right. So that leads into the next discussion point about COVID, where we've seen within lots of practices a push to move more applications to the cloud, so you'll have access anytime, anywhere. Have you seen that? What else has changed within the sort of the organizational side of the practice as a result of COVID? What challenges have you had? How have you addressed that? Have you sort of moved towards remaining super efficient and super productive and provide the highest level of patient care during what's been an extremely difficult period over the last 18 months or so?
Understatement, no question. came upon us, as we know, very quickly. None of us had time. Like Y2K, we were told for years, get ready, it's coming. The pandemic hit, it was like, bang, we have to turn on the dime. We had to pivot immediately.
Yeah.
Fortunately, this group was in a pretty good way because we already had made a lot of investments that were kind of going in that direction. So when it was green lighted that we needed to pivot, we were in a position to do that. I had some strategic partnerships already with some cloud players that could turn up things like telehealth and the whole concept of having a board meeting via like what we're doing right now was foreign to our doctors 15 months ago. Now it's pretty commonplace where let's get on a video call and we'll talk it through.
Right.
I think that's a positive outcome because now our physicians can have an engagement with a patient via telehealth, and whether it's a post-op, whether it's a follow-up, telehealth will be part of our practice going forward for good or for bad. And I think the fact that COVID forced it on us culturally allows us to drive some more innovation into our process. Patients are more accepting and say, hey, I'm going to send you the registration information on your phone and you're going to fill it out for me.
Yeah, they have no choice. That's the way in which you have to engage. You're not going to come into the office anymore. Yeah, not going to come into the practice. Right.
That's right.
So what about on the surgical side of the organization? Like you provide lots of different services, but surgery is the backbone, it is the highest revenue part of the organization. What changes have you had to make to ensure that you can still provide on the surgical side the highest level of care?
Well, that's a great point. We're a large group, and I said earlier we have a lot of individuality within our group, and there was a lot of preordained culture that came with certain camps, and it's hard to change a process when the perception is our process is fine. So from a surgical standpoint, we are rapidly changing our process to leverage technology in our surgical communication internally and also with outside parties. Whereas I think 2-3 years ago, we were probably a little too dependent on paper-based systems.
Right.
So
things like being able to communicate electronically with the equipment vendors, having more automated ways in which you can reach out to patients and the hospitals, all those are really part of how you see the strategy moving forward. And really COVID was that kickoff point to make sure that everybody realized we just can't do things the way in which things were done before.
No question. And it, not just here. We're seeing hospitals change their process as well. Whereas it wasn't too long ago that the requirement was you need to fax in this booking sheet. That's how you got it to me. Whereas now they're standing up portals and we're basically registering our patients to portals. Now we're trying to create HL7 messaging between our systems so we can more efficiently pass one set of data. So everything is evolving very quickly, but it's all, I think, to the good, it's to the patient's benefit, some of the things that we're doing.
Interesting. Like COVID has really given that kick up the proverbial healthcare behind to be able to make sure everybody gets to where all the other industries have sort of got to maybe a decade ago. So that leads, I have 2 more questions. Firstly, turn around, you've got these jerseys on the behind. You have to tell me a little bit about those.
My Gronk up there. That's my Gronk. And that's the Avenger up there. That's actually, can't see it. That's Tom Brady. It's Avengers costume. That was after the Atlanta comeback. And then I got my Red Sox here. So yeah, I have some fun with my vendors because I have vendors from across the country, and one of my favorite vendors is a Steelers fan, and some my friends from Atlanta. So can't get enough of that. So it's all in good fun. Sports is, I think, is a good icebreaker.
Yeah, we see that a lot of orthopedic groups. You walk around and they have the jerseys of all the stars that have had surgery at the practices, and it's a great way to give you that confidence. So if you had $1 billion, $1 billion, you said $1 billion beforehand to spend on healthcare, okay? Where is it you think that the industry needs the most amount of investment? What are the biggest problems you want to go off and spend? How would you go off and spend that $1 billion?
Wow, doesn't seem like very much these days, but I would buy my own cloud. Unfortunately, $1 billion won't buy it, unfortunately. I think we'll probably end up spending $1 billion by the time we're done, which is a sad thought.
Right.
But if I had access to tremendous resources like that, I would complete the mission to make sure that the cloud was the driving backbone behind how everything worked. Because it's not a question of if we're going to be migrating to the cloud. It's a question of, how soon are we going to get there, and when are we going to complete the mission? Doesn't make sense for us to spend that kind of money when private sectors are doing it on our behalf, and we can, in essence, pay some timeshare values to get that same resiliency, dependency, safety at all. But I think in time, it's a difficult choice too, because you lose some of that independence. We've been so creative with some of the things that we've done. We've organically created some of our own code base. So you have to give up some of that independence in order to bolt onto that security. And then you're beholden to that software as a service vendor to solve your problems. So choose wisely.
At the same time, you can benefit from the creativity that those vendors have, and what looking to offer, and also the experience they've got by working with other practices or other similar types of entities, and bring those best practices together to help your organization.
And critical choices that all companies need to make with their software as a service partners, because as you stated, their innovation, their timeline will affect our outcomes and not our survival necessarily, but our ability to deliver the quality that we've been seeking to do all these years.
Well, Mark, thank you so very much for your time today. Thank you for being a guest on SurgiPod. It's been a real pleasure speaking with you, a thought leader in the industry, a data guy, a manager, building a fantastic practice.
Pat's fan. Okay,
that's true.
my Bucks won this weekend, but
well done.
Our Pats didn't. We'll be there.
Well, thank you again, and you should have a great day, and wish you all the best of luck with everything, and thank you again for your time.
You're welcome. Let's talk with you.
Thank you so much for listening to SurgiPod. We hope you enjoyed this episode. Remember to subscribe wherever you get your podcast to stay up to date with new episodes.